aids required, like what we all require to, before we are doing patient, what we need to do, like?
See, entire diagnosis and treatment planning, Pooja, it will be difficult to cover on this interview because it's like a separate chapter by itself, but definitely I can say that it is something similar to what to do in conventional implantology. Most of us and most of the doctors, you will be surprised if I tell you, we can work only with a simple OPG X-ray. The use of CBCT X-ray is almost minimal, but it will become very difficult for me to explain why CBCT may not be needed. Only OPG you can handle the cases with experience. So all this, it sounds very retrograde. So I'm sure some doctors who are used to watching the CBCT, they will feel it's a retrograde thought of saying not to use CBCT. I'm not saying don't use CBCT. I'm saying the need for it starts reducing in this technique as opposed to conventional implantology, where it is almost like a must-have. Any kind of diagnostic aid, whether you do a mounted study model or a OPG or CBCT, definitely it will help you in a better diagnosis or a planning. But if you've done 3, 4, 5 or maybe 10 cases and you start getting the knack of it, most of us, including me, we work only with the OPG X-ray.
Great.